Hi friends, today I will talk about the special fluid Dextran. First is a disclaimer. This video is made for educational purpose only and the information provided here should not be used as an alternative to diagnosis, treatment of any person or animal. Please seek the help of a medical expert for diagnosis, prevention and treatment of the medical illnesses. There is no endorsement for any brand, company or product. Dextrans are glucose polymers. They are produced by the bacteria when incubated in a sucrose medium. They are available in two forms, Dextran 70 with a molecular weight of 70,000 and Dextran 40 with molecular weight of 40,000. This is the low molecular weight Dextran. Coming to the pharmacological basis, both these Dextran they expand the blood volume, but they are not suitable for blood as a blood because they don't carry oxygen. They are not a substitute for plasma protein because they lack the clotting factors. Dextran 40%, Dextran 40, that is 10% solution, expands the blood volume more than the Dextran 70, that is 6% solution, but its duration of action is shorter due to rapid excretion. Both dextran, especially the low molecular weight dextran, it improves the microcirculation and helps in prevention of thromboembolism. The mechanism of action of dextran, they act by expanding the blood volume by attracting and holding the water in the bloodstream. They improve the blood flow by expanding the blood volume. Dextran helps red blood cells to reach the small vessels and deliver oxygen to organs and tissues. They help in preventing the clotting because they prevent the platelets from clumping together and forming blood clots. Because they bind to the platelets and blood vessels, they cause reduction in von Willebrand factor and also helps in activation of the plasminogen, which breaks down the blood clots. They are used in ophthalmology as a lubricant. Dextrans are indicated in various conditions. In patients with hypovolemic emergency, the short-term rapid extension of the expansion of the plasma volume is required, and here we can give dextrans because they help in preventing the or treating the shock or impending shock from burn, surgery, hemorrhage or trauma. They are helpful in prophylaxis of deep vein thrombosis and post-operative and post-traumatic thromboembolism. Since they prevent the uh, thromboembolism and improves the blood flow, they are useful in threatened vascular gangrene. They are also used in imaging like nuclear medicine, MRI, scintigraphy. In ophthalmology, they are used in dry eyes as a lubricating agents. In food and chemical industries, they do have an important role. The various adverse effects seen with the use of dextran are acute renal failure. Dextran 40 can cause increased urine viscosity and reduces the urine flow. So it will worsen the kidney failure, especially in patients with reduced functions. Allergic reaction can be seen with dextran in the form of itching, hives, joint pain, and very rarely severe allergic reaction like anaphylaxis. Dextran can interfere with blood grouping and cross matching also. The various contraindications for the use of dextran are they should be used with caution in patients with bleeding disorders, especially patients of thrombocytopenia, hypofibrinogenemia, because it may increase the bleeding risk. Avoid using dextran in patients with heart failure because rapid administration of dextran can lead to overload and worsening of the symptoms. Avoid using it in patients with renal disease because it will further worsen the kidney functions. Patients with severe dehydration and with known hypersensitivity to dextran, here we should not use dextran. Other conditions which required cautious use of dextran are severe liver disease, pre-existing edema, asthma, diabetes, epilepsy, and seizure. The precautions which are to be taken while administering the dextran are avoid. You have to be very careful in using it in patients with impaired renal function or oliguria, in patients with active hemorrhage or chronic liver disease, patients at risk of developing or developing pulmonary edema, or in patients with congestive heart failure. We should ensure that hematocrit should not be allowed to fall below 30. Always correct the dehydration before or at least during dextran infusion to maintain adequate urine flow and hence preventing the acute renal failure. The anticoagulant effect of the heparin is enhanced when it is used with dextran. As dextran may interfere with blood grouping and cross matching, we should always collect and preserve the blood sample prior to the infusion of dextran. Along with the dextran, patient may require blood coagulation factors or electrolytes. Dextran 40, it is given as IV infusion as 10% solution in 0.9% sodium chloride or 5% glucose. The dosage depends on the patient's need. Adult patient with shock may require 500 ml of rapid IV infusion. In patients with hemorrhagic shock, the dosage is 500 to 1000 ml of 10% solution if there is significant blood loss, administered rapidly as needed. Patients with cardiogenic or septic shock, we can give Dextran as 500 ml in 1 hour, followed by another 500 ml in 4 to 8 hours if needed. In the first 24 hours, total dose should not exceed 20 ml per kg. So Dextran 40 can be given subsequently in dose of 10 ml per kg per day for up to 5 days. In patients with thromboembolism, the regimen is day 1 give dextran as 1500 to 1000 ml. Sorry, in day 1 give dextran as 500 to 1000 ml over 4 to 6 hours. Day 2 we can give 500 ml over 4 to 6 hours, and it can be given up to 10 days as a 500 ml over 5 to 4 to 6 hours on alternate day. And in for surgical prophylaxis, we can give dextran 40 as 500 ml of dextran pre-operatively and daily post-operatively for 3 days. Dextran 70 is given IV as 6% solution, and the total dose should not exceed 20 ml per kg in first 24 hours and 10 ml per kg on subsequent days. Whenever we are giving Dextran, always monitor the bleeding risk like melena, wound seroma, volume overload. Always monitor the renal function test. Watch for oliguria or anuria, which can indicate the renal failure. Monitor the systemic allergic reaction, local allergic reaction. Always hydrate the patient before administering the Dextran. Monitor the liver function test, serum bilirubin, AST, ALT, etc. Albert Einstein has said, only a life saved for other is a life worthwhile. With this, I conclude today's topic. Thank you. Keep learning.